Hemorrhoids. It's not a topic many want to discuss openly, yet millions silently suffer from its discomfort and pain. In this video, we'll dive deep into the world of hemorrhoids, uncovering the early signs, dangers, and effective treatments. Stick around and watch this video until the end. You might be also suffering from hemorrhoids. Welcome back to our channel, where we bring you valuable insights into health and wellness. Without wasting your time, let's get started. Let me ask you this. Have you ever felt a discomfort in your backside that made sitting or even walking a challenge? If so, you might have experienced the silent menace known as hemorrhoids. But fear not. Today, we're going to demystify this condition and equip you with the knowledge to recognize it early on. Hemorrhoids, often called the silent agony, affect millions worldwide, yet they're often overlooked or dismissed due to embarrassment. But here's the thing. Ignoring the signs can lead to worsening symptoms and complications down the line. So, if you've ever experienced itching, pain, or bleeding in the nether regions, you're not alone, and it's time to break the silence. Understanding hemorrhoids. So, what exactly are hemorrhoids? Well, simply put, they're swollen and inflamed veins in the rectum and anus. While they're often associated with discomfort and embarrassment, the truth is, they're more common than you might think. Factors like straining during bowel movements, pregnancy, and even genetics can contribute to their development. Hemorrhoids come in two main types, internal and external. Internal hemorrhoids develop inside the rectum and are typically painless, but they may cause bleeding during bowel movements. External hemorrhoids, on the other hand, form under the skin around the anus and can be more painful and noticeable, causing itching, discomfort, and swelling. But why do these veins become swollen in the first place? Well, it all boils down to increased pressure on the rectal and pelvic area. This pressure can be caused by various factors, including constipation, diarrhea, obesity, or even sitting for extended periods. Understanding the root causes of hemorrhoids is crucial for prevention and management. By addressing underlying factors like diet, hydration, and bowel habits, you can reduce your risk of developing this pesky condition. Recognizing early signs. Now that we understand what hemorrhoids are, let's talk about how to spot them early on. Paying attention to these signs can make a world of difference in managing the condition. Number 1. Itching and discomfort. One of the earliest signs of hemorrhoids is persistent itching or discomfort around the anus. This sensation may worsen during or after bowel movements. It's often described as a feeling of uneasiness or irritation that just won't go away. Number 2. Bleeding. If you notice bright red blood on your toilet paper or in the toilet bowl after a bowel movement, it could be a sign of hemorrhoids. While alarming, this bleeding is usually painless and occurs when the swollen veins rupture. However, it's essential to rule out other potential causes of rectal bleeding, such as anal fissures or colorectal cancer, so be sure to consult a healthcare professional if you experience this symptom. Number 3. Pain or soreness. External hemorrhoids can cause pain or soreness around the anus, especially when sitting or during bowel movements. This discomfort may range from mild to severe, impacting your daily activities. It may feel like a constant ache or a sharp, stabbing pain, making it difficult to find relief. Number 4. Swelling or lumps. In some cases, you may feel swelling or lumps around the anus, indicating the presence of external hemorrhoids. These swollen veins can be tender to the touch and may cause discomfort when sitting or moving. You might notice a bulge or lump protruding from the anal opening, particularly after straining or bearing down during bowel movements. Remember, early detection is key to managing hemorrhoids effectively. If you experience any of these symptoms, don't hesitate to seek medical advice. While hemorrhoids are rarely life-threatening, they can significantly impact your quality of life if left untreated. Understanding the risks. Now, let's address a common question. Are hemorrhoids dangerous? While hemorrhoids themselves aren't typically life-threatening, they can lead to complications if left untreated. Thrombosis. External hemorrhoids can develop blood clots, causing a condition known as thrombosis. This can result in severe pain, swelling, and inflammation in the affected area. While thrombosed hemorrhoids can resolve on their own, they may require medical intervention to alleviate symptoms and prevent complications. Strangulation. In some cases, internal hemorrhoids can become prolapsed, meaning they protrude outside the anus. If a prolapsed hemorrhoid becomes trapped outside the body, it can cut off blood flow, leading to strangulation and tissue damage. This requires immediate medical attention to prevent further complications. Anemia. Chronic bleeding from hemorrhoids can lead to anemia, a condition characterized by a deficiency of red blood cells. Anemia can cause fatigue, weakness, and shortness of breath, impacting your overall health and well-being. While hemorrhoids themselves aren't inherently dangerous, it's essential to recognize and address the symptoms promptly to prevent potential complications. If you experience severe pain, persistent bleeding, or any other concerning symptoms, don't hesitate to consult a healthcare professional for proper evaluation and treatment. Treatment options. Now that we've covered the early signs and the risks, let's talk about treatment options for hemorrhoids. From home remedies to medical interventions, there are several ways to alleviate symptoms and promote healing. Lifestyle modifications. Transforming your daily habits can work wonders in alleviating the discomfort of hemorrhoids. Embrace a fiber-rich diet, ensuring ample intake of fruits, vegetables, and whole grains to promote smoother bowel movements. Hydration is key. Aim for plenty of water intake throughout the day to keep stools soft and easy to pass. Additionally, be mindful of your sitting habits, taking breaks to move around and avoiding prolonged periods of sitting, which can exacerbate hemorrhoidal symptoms. Harnessing the power of topical relief. When the discomfort strikes, turn to over-the-counter remedies to provide immediate relief. Explore the vast array of creams, ointments, and suppositories specially formulated to target the itching, pain, and inflammation associated with hemorrhoids. Look for ingredients like witch hazel or soothing hydrocortisone to calm the affected area and restore comfort. Sclerotherapy. When conservative measures fall short, sclerotherapy emerges as a promising solution for internal hemorrhoids. This minimally invasive procedure involves the injection of a specialized chemical solution directly into the swollen vein. As the solution works its magic, the vein gradually shrinks and fades away, offering respite from the discomfort and inconvenience of hemorrhoids. Rubber band ligation. For stubborn internal hemorrhoids resistant to conventional treatments, rubber band ligation presents a viable option. During this outpatient procedure, a tiny rubber band is carefully placed around the base of the hemorrhoid, effectively cutting off its blood supply. Over time, the hemorrhoid withers away and detaches from the surrounding tissue, paving the way for lasting relief and improved quality of life. These are just a few of the many treatment options available for hemorrhoids. The key is to work closely with your healthcare provider to find the best approach for your individual needs. And there you have it. Everything you need to know about hemorrhoids, from their early signs to effective treatments. Remember, awareness is the first step towards prevention and healing. If you found this video helpful, don't forget to give it a thumbs up and subscribe for more valuable content. Until next time, take care of yourself. And as always, stay healthy.